Doctor, really need your guidance and your insight at this critical time because it's I don't know if you follow me on social media. I've been trying to make sense of the data. I've kind of almost given up. It's tough. What are you seeing on the ground right now?
Thanks so much for having me. So the first thing is that with the Omicron variant, which is the main thing we're facing in our region now and in actually many areas of the country, it is a less severe variant. And so tracking cases as the primary metric doesn't make as much sense anymore in terms of risk to society, risk to people's health. Tracking hospitalizations and other metrics that show healthcare demand based on infections is more important. And even when you look down at hospitalizations, as of yesterday, our hospital had 115 people with COVID-19 out of about 360 beds. 60% of those happened to incidentally test positive because they were here for other things. And 40% were actually sick with COVID-19 in our hospital. And so even within the hospitalization data, if there was a more systematic way of tracking hospitalizations due to COVID, illness and disease due to COVID, that would be a bit more informative because those would actually be additive in terms of the cases and the strain on hospitals. That said, we are in a very, very significant staffing shortage because anybody who has an Omicron case, asymptomatic, mild or not, has to be out of work for at least 5 days according to the new CDC guidelines. And unless you have staff taking care of you out of bed, that bed doesn't mean much when it comes to healthcare capacity. And so that's what we're contending with right now. And that's my most immediate concern.
This is so important. And Dr. K, let's go into that first part about hospitalizations, because as we've been talking about it, by the way, for months on this show, that cases are not a great metric anymore. We are a data-driven network. In your hospital, and God, by the way, again, God bless all the workers and you and everybody else that's just putting in hours I can't even imagine. How many of those COVID patients are there because of COVID, or are there with COVID, were there for something else, but then have to incidental positive test, or somewhere in the middle?
There for something else with COVID comprises 60% of the patients in our hospital who have COVID-19 as of yesterday. And 40% are actually there because of illness due to COVID. And that is a much different breakdown than what we were seeing certainly earlier in the pandemic, when folks that we had to admit with COVID-19 were certainly there with respiratory issues or other complications directly related to their infection. So that speaks to the lower severity of Omicron, but it also speaks to our estimates on strain for hospital capacity, because logically, you're really only concerned about that 40% when it comes to overall system capacity. That said, operationally at hospitals, you still have to worry about isolating patients with COVID-19, making sure you have the right PPE, even if they're not there for that reason. And so it's still good to track overall hospitalizations for that reason as well.
Okay, and this is a critical point too, but just because 60% may be with COVID, that's not, I'm assuming, doctor, we can't just say, well, they wouldn't be there otherwise. They're in that 60%. There may be people who have other problems as to why they're there, but COVID perhaps has exacerbated them to make them go to the hospital. It's not a clean-cut differentiation, is it?
That's very true, and it all depends on how you define there with COVID or there because of COVID. That 60% denominator could include folks who have a clinical problem even after they've gotten over their COVID infection, but that problem is related to dealing with a fever and being at home and maybe becoming dehydrated. And so it does get a little bit murky. But what I can say is that the folks coming in with respiratory disease, the classic symptoms of COVID-19, low oxygen levels in their blood, that breakdown has actually gotten a lot less with this latest wave, which is encouraging because that has everything to do with ventilator demand, ICU demand, and everything that we've been contending with this whole pandemic.
You mentioned something at the top, and again, it's early and it's easy to be confused at this time about the quarantine times. And I think all of us probably watching know somebody that's tested positive. We're trying to figure out what to do about the quarantine. So here's my question, doctor. If I break my leg and I come into your hospital and I come in and I need to stay overnight, it's a bad break. I test positive for COVID, but I don't have any symptoms. You guys patch me up, fix my leg, put the cast on. Am I stuck at your hospital for 5 days?
Absolutely not. So when you are ready to be discharged clinically, when you are feeling better, and when it is safe for you to go home or wherever you live afterward, we will send you home, whether that is day 2 or day 4 or day 8. So you're not bound to being in a hospital just because of the isolation guidelines. All the isolation guidelines are is guidance for basically how long you remain away from others, whether that's at home or in an institution.